My name is Mike Lang, and I am an education consultant with CancerControl Alberta, as well as being a cancer survivor myself. It's been a while now, but I still clearly remember how overwhelmed I felt during those first few whirlwind weeks after I was diagnosed. So if you're watching this video and feeling the same way, just know that it is normal. And also know that by watching this video, you are starting off on the right foot. Everyone's cancer experience is unique, with different treatments and side effects, but that doesn't mean we can't learn from each other's stories. In this video, we will hear from two people, Doug and Shannon, about what their cancer experience was like. You will also hear from an oncologist, pharmacist, and nurse about their role on your healthcare team. Our hope is that you will learn more about what to expect as you begin your own cancer treatments. So let's get started.
My name's Doug. I lived in Calgary for 11 years and I was diagnosed with cancer 3 years ago. I was diagnosed with head and neck cancer. I'd just been retired for 2 months. It was a very shocking experience for both my wife and I. I really didn't have any idea what to expect about chemotherapy. Nobody close to me had really gone through extensive chemotherapy. So this was all a brand new experience for me personally.
My name is Shannon. I am from Calgary. I was diagnosed with Hodgkin's lymphoma in 2015 and had reoccurrence Hodgkin's lymphoma since then. And I'm currently in remission. When I first got diagnosed with cancer, I was actually going into a surgery for a biopsy, and the CT scan told me that I had cancer, so it was very terrifying. I was terrified of what was coming next, of the unknown, of how I was going to raise my daughter and support myself and her during this time and get myself healthy.
Fear mainly, I guess. Fear of the unknown is what my initial reaction was to when I found out I had to take chemotherapy or receive chemotherapy.
So I really had no idea, other than maybe I guess some films. I knew the films probably weren't quite on track, but I knew that it'd be an IV, but that was kind of it. And really, I didn't even know what to ask at that time to help me get to that place. So it was just, okay, let's go do this. And that was it. I was just get in there and get this done.
Cancer care has changed really dramatically over the last number of years. When we use the term systemic therapy, it now reflects more than the traditional chemotherapies that a person may have had personal experience with. Chemotherapies are powerful drugs, mostly given intravenously into the bloodstream, but occasionally given in pill form. Chemotherapies are strong medications which interfere with how one cell divides to become two. And so a tumor grows not because the individual cells increase in size, but because cells multiply. The chemotherapies which have been in use for several decades are intended to interfere with how DNA is replicated within the cancer cell. And in essence, one cancer cell is prevented from becoming 2, and then 4, and so on. One of the things a patient can do is empower themselves by gaining as much knowledge as possible about their individual treatments. Using these videos, for example, is a good way to try and start that journey. Your oncologist and your healthcare team will work with you to design a treatment plan for your cancer, but it's also important that a person understands exactly what treatment they are taking and what the goal of therapy is. And so in some instances, the goal of treatment will be to cure a person of their cancer. In other instances, the goal of treatment may be to control the cancer and therefore delay or even prevent cancer-associated symptoms. So you'll have an opportunity regularly to meet with your oncologist and your healthcare team, and that's your opportunity to ask questions about your treatment and also ask questions about any side effects you might be experiencing. All of the cancer centers in Alberta will have a way for you to contact them with your questions and concerns. Cancer is not just one disease. So a person with breast cancer may get a very different treatment from a person with lung cancer. But even within those individual cancers, treatments can vary quite significantly. One person's breast cancer is not the same as the next person's breast cancer. There are cancer centers across the province where you may be eligible to receive your treatment. Some cancer treatments can be delivered at smaller community centers, while other cancer treatments can only be delivered at larger cancer centers. This is something you can discuss with your healthcare team.
My first chemo appointment was surreal because I still didn't believe I had cancer. I was feeling great. I just retired. I had no physical symptoms other than a small lump in my neck that was painless. And I was feeling like I was on top of the world. You know, I was feeling great. So I didn't really believe I had cancer. The difference between expectations and what actually happened for me really happened in the chemo room, in the day room as they call it. I had no idea what to expect when we went in there. I had no idea, for example, that people sat in chairs much like this and got an IV. I didn't know what the physical environment was going to be like, so that was a surprise or something that I had no idea about, something that was unexpected. It was a very pleasant environment, but I just didn't know what it was going to be like. For someone who's never had chemotherapy before, I think the closest analogy for me is it's like somebody giving blood.
My particular treatment was 4 different chemos, and 2 of them were actually IV, and 2 of them were hand pumped from nurses just because they have to go in slower. And one of them was really hard on my veins, but the nurses really worked with me, and by the next treatment I had what was called a port, so it all went through the port. It made my treatment way more bearable. During my chemo treatments, I did bring somebody with me. I brought a supporter with me, I believe, every single time. There might have been a couple that I decided that I could just do on my own, but I liked somebody to be able to drive me there and drive me home, and it was just good to have another body there.
So when you arrive for your appointment, you'll check in at the front desk and they will ask to see your ID. And then you will sit down in the waiting area and wait until a nurse calls you in for your treatment.
When you arrive for treatment, your chemotherapy will be ready for you. The chemotherapy has been thoroughly checked by regulated pharmacy professionals.
One thing we really like to stress is that chemotherapy should not be painful. The needle does not stay in your vein. It's just used to introduce a thin plastic tube. So sometimes people have a central venous access device instead of an intravenous, but you will know if you'll be getting one of those because it's something that will have been discussed between you and your oncologist. On the day of your treatment, if you feel you're coming down with an illness or feeling very unwell, please call us and we'll advise you what to do. So when you're having your treatment, we do identify you by asking your name and your birthday. So you'll never forget your birthday because 2 nurses will ask that every time we hang a medication.
It is really important before your first clinic visit to make a list of all the medications you are taking. This needs to include your prescription and non-prescription medications, even inhalers, patches, and creams that you're taking. This medication list needs to include any natural supplements that you are taking. For example, high-dose vitamin C can interact with some treatments that we have here and might make the treatments less effective. So when you visit the clinic, you're going to get prescriptions from either a physician, a pharmacist, or a nurse practitioner. Some of these prescriptions will need to be filled ahead of time prior to chemotherapy, such as a prescription to prevent nausea and vomiting. We'd like you to fill these prescriptions at your community pharmacy where you normally fill your other medications. It's important to have all your medications filled at the same pharmacy so that the pharmacist has a good idea of all the medications you're taking and can evaluate if there's any problems in combining these medications. So please try and remember to take your medications before your chemotherapy appointment. If you have forgotten to take these medications, please tell the staff that are treating you. And if for some reason something comes up and you can't make your chemotherapy appointment, please call as soon as you know. Chemotherapy is really expensive and we could use that treatment time for someone else also.
I guess my first concern or impression was I would lose my hair. So I thought, well, I'm going to go home and shave my head and get ahead of this. The experience of nausea, it was a little bit like having the flu or perhaps the worst hangover of your life kind of thing. All you had to do was ask if you had a problem or a question or a symptom that wasn't being well managed or a side effect that wasn't being well managed.
Nausea was a big one. It would hit about, I'd say about 3 or 4 hours after I went home, I would start feeling nauseous. but they have lots of drugs to help control that. I never actually was nauseous.
If you are prescribed an oral chemotherapy, a pharmacist will talk to you about the potential side effects and how to manage these side effects. Keep in mind, you will not experience all the side effects that the pharmacist reviews with you, but if they do occur, it is important that you know how to manage them, and if the side effects are serious, the pharmacist will let you know who to contact.
You might experience lots of little side effects while you're on chemotherapy, but as caregivers, what we're really concerned about is fever. That is the one that's very important to us, and we ask you to notify us if you have a fever of over 38 for more than an hour.
Occasionally, fever is the first and only sign of infection, and if untreated, infections can be very serious in a person receiving chemotherapy. If you develop a fever, you should contact your oncologist or your healthcare team as soon as possible. It's important that you avoid medications like Tylenol and ibuprofen if you have a fever, because those medications can mask the fever. Occasionally, there are issues which will make us delay a treatment with chemotherapy, such as low white blood cell count as a side effect of chemotherapy. There are many different side effects which may occur from chemotherapy. For more information, please check out the video regarding side effects.
The thing that mattered most to me during chemo treatment was, is it working? Is it being effective? Is it making my tumors go away? Am I going through all this nausea and other side effects for a good reason?
As a mother, the thing that mattered most was that I was still able to parent my daughter. So the day-to-day, how am I gonna do the day-to-day things? My team was really great, my nurse, my clinical nurse, as well as my doctor. Being in contact with them and making sure that they knew what I was going through so that they could give me resources, whether it be outside resources or medication for a specific symptom, just so that I could live the day-to-day.
You will have been asked to complete the Putting Patients First form. The purpose of this form is so that we can really find out what's important to you and we can address those concerns. There are a wide variety of support services and resources available to you, so please do access them. It is very important that you prioritize your care, so do ask for help, use the resources, reach out to family and friends, and we just don't want you to feel alone.
What I'd really encourage patients to do is ask lots of questions. Ask questions to other patients, ask questions to the nurses that you interface with, ask questions to your medical staff, your doctors during your regular meetings. We were very, all our questions were met with open arms. It was very welcoming.
It's a positive thing to take your own medical case in your hands and ask questions, because your doctor doesn't always know what questions you have. And there's a lot of questions, and you'll have questions in the first appointment that are different than the second appointment, and so on and so on. So it's good to continually ask questions.
Being proactive helped me to feel like I was in control of my destiny.
Even though life will get hard and you will want your old life back, life will be good again. It will be different, but it will be good, and it can even be good during the treatment.
I think Doug and Shannon's stories show us that it's possible to live well despite a cancer diagnosis and treatment. As you can see, both of them had side effects they needed to manage, but by communicating clearly with their healthcare team, they were able to get the help they needed. Make sure to ask for help when you need it, and remember that you are an important part of your healthcare team. Also, as you go through your treatments, I hope you always remember that there is so much more to you than cancer. When people look at you, they may see a cancer patient. But remember, cancer is just a piece of your life. It may be a big piece for a while, but it does not define who you are. I've seen many people live well despite going through cancer treatments. And with the help of your friends, family, and healthcare team, I know you can do it too. You have what it takes. I wish you all the best and good luck.